Hello, Dr. McMahon and Dr. Russell. My name's Paul Scotland, student number 4077313. This is my video presentation on the HealthStar food rating system. The HealthStar system is a front of package labelling system introduced in 2014 by the Australian federal government, whose aim was to provide an easy to understand summary of the healthiness of a food. Basically, the more stars a product has, the healthier the product is supposed to be. The number of stars is calculated through a reductionist algorithm which takes into account the energy content, sodium, saturated fat, protein, fibre, total sugars, and fruit, vegetable, legume, seed, or nut content. It does not, however, consider the level of processing of the foods, origin of products, price, actual consumption patterns, or typical consumer of the product. So what is the issue? Well, a number of products that are widely regarded as unhealthy have retained quite high health star ratings. For example, Nutrigrain. Nutrigrain is roughly 1/3 by weight sugar and has a 4 health star rating, as can be seen. However, healthier products such as tree nuts and olive oil are scoring worse health star ratings than Nutrigrain, despite these products being recommended by various medical journals. For example, Raymond et al. 2018, published in the New England Journal of Medicine, states that major cardiovascular events were lower among those assigned to a Mediterranean diet supplemented with extra virgin olive oil or nuts. And Sneed et al. States that evidence suggests added sugars are associated with chronic disease states like obesity and type 2 diabetes. So how does this link to the broader public health? Well, the HealthStar system was designed to help combat the obesity and non-communicable disease epidemics currently underway in Australia. However, according to Lawrence et al. 2018, there is no evidence the HSR system will contribute to a reduction in obesity or non-communicable diseases. By looking at the HealthStar rating system through the socio-ecological model of public health, we can say that this is a public policy which, according to this model, impacts everything else beneath it. Because this model is flawed and, as per Lawrence et al., does not help contribute to a reduction in obesity or non-communicable diseases in Australia, this failing of public policy is likely to impact every other part of this model. In particular, it impacts individual knowledge, skills, and attitudes because it is a front of package label, consumer-targeted medium, and without this medium being reliable and accurate, it will impact the results on individuals and, of course, every other factor in this model. So in terms of the impact on food systems of the HealthStar rating system, at the regional and national levels, the HealthStar system impacts what people choose to eat because it's been implemented in Australia. And this can obviously have a significant impact on their health. Because front of package labelling can impact consumer demand and the choice of ingredients used by the food industry, this has an impact on the rest of the food system. At the global level, industry lobbies and governments in other countries can refer back to the precedent set in Australia when considering options for front of package labelling. So what can be done to improve the HealthStar rating system? Well, first of all, policy should be designed through a public health lens, and this includes removing most of the industry lobby influence from the design process. The policy should be based on the best available science, and it should align with the Australian dietary guidelines.